What we find here is a man brought to the emergency after having some accident and injured perineum. There is an urge to micturate but unable to pass the urine, and there is some blood at the tip of the meatus with the extensive swelling of the penis and scrotum. In such a scenario, usually there will be either a rupture of the bulbar urethra, which is called as anterior urethra rupture, or it could be membranous urethra rupture, which is posterior urethra rupture. Let us look at a sagittal section of the male pelvis, and you will find that male urethra is having certain parts. If it is passing through prostate, you say prostatic urethra. If it is passing through deep penile pouch, you will say membranous urethra. And if it is passing beyond that, then it will be spongy urethra. Spongy urethra also is having two parts, a short bulbous spongy urethra and a long penile spongy urethra. Now, understand the kind of history given could be either a bulbous rupture of urethra or it could be membranous rupture of urethra. Since prostatic rupture of urethra or penile spongy rupture of urethra is not going to present with such a history. The history was inability to pass the urine, blood at the tip of the meatus, and extensive perineal swelling. So let us proceed further with the details. You have to understand, in the anterior abdominal wall, there is a Scarpa's fascia, which will continue in the penis as penile fascia, then into the scrotum as the scrotal fascia, and then will continue as the Colles fascia, ultimately meeting with the perineal membrane at the perineal body. And perineal membrane is a boundary line between the superficial perineal pouch here, which is below the perineal membrane, and the deep perineal pouch, which is above the perineal membrane. In the deep perineal pouch, you will have the membranous urethra, and in the superficial perineal pouch, you will have the bulbous spongy urethra. Now, these are some of the basics. Now, we want to discuss what is the difference between bulbous rupture of urethra or the membranous rupture of urethra. Let us look at either of the cases. Understand, sometimes there can be a straddle injury. The legs are wide apart and the patient is landing on the bulbar urethra, like riding a bicycle on a bumpy road and landing on the bulbar urethra, rupture of bulbous urethra. So how this patient is going to present as? You will notice that there is a rupture of bulbous spongy urethra and urine will be below the perineal membrane in the superficial perineal pouch. It can also move into the scrotum and the penile shaft, and urine can also move into anterior abdominal wall. Actually, 4 places. What are the 4 places? The anterior abdominal wall under Scarpa's fascia, and in the penile shaft, and in the scrotal space, and also social perineal pouch. Now, why this urine cannot enter the deep pouch? Because prevented by perineal membrane. And why this urine cannot enter ischio-rectal fossa posteriorly? Because prevented by Colles fascia. And why this urine cannot enter the thigh? Because prevented by fascia lata of the thigh. So this urine cannot go to 3 places, that is the deep pouch or ischio-rectal fossa or the thigh, but it is restricted to only 4 places, that is social perineal pouch, the scrotum, penis, and the anterior abdominal wall. This is a bulbous rupture of urethra, straddle injury. There will be extensive swelling in the perineum region, blood at the tip of the meatus, and difficulty passing the urine. This appears to be our patient. Then what about the other variety? This is called as anterior urethra rupture, and the other variety will be posterior urethra rupture. Like in this case, there was a pelvic fracture, and due to pelvic fracture, there is some puboprostatic ligament pulled, and there is a rupture of membranous urethra. Now, the urine will be in the perivesical space, including retropubic space of Rajesh. But this urine rarely will find its passage towards the superficial perineal pouch. Presentation could be the same, difficulty passing urine and blood at the tip of the meatus. But in this case, you will not find extensive perineal swelling. That will be missing. Instead, there will be extraperitoneal extravasation of urine in the perivesical space. And this urine cannot enter the peritoneal cavity because the peritoneum is still intact. So it will be extraperitoneal extravasation of urine around the bladder and around the prostate. And if you do per rectal examination, you will find there is a high riding prostate gland also. So that kind of picture was not given in our patient. Then what was the picture given? Let us go back to our question again. See, it is telling unable to pass the urine and blood at the tip of the meatus. Also, extensive perineal swelling. Actually, it will be something like butterfly-shaped perineal hematoma. Typically, they have not mentioned about any high-riding prostate gland at all, and they also have not mentioned any pelvic fracture. So the thing is, point 1, pelvic fracture, and point 2, high-riding prostate, and point 3, missing perineal swelling will go in favor of the rupture of membranous urethra. But then none of this is mentioned. So what does it mean? It means it is definitely a case of bulbous rupture of the urethra. You mean to say choice number B will be the answer? Yes, choice number B is the answer.